In a recent lecture, Dr. Dempsey said anything foreign in the body can lower your threshold for activation of mast cells. Could a SIRVA do that when a vaccine is mistakenly deposited into the tendon instead of the muscle of the shoulder and lingers there for a long time, causing inflammation and damage?
So is the question, I mean, that's a tough question, because that phenomena, where the injection is given in the wrong location in the shoulder, can cause itself, like just local inflammation, and issues with the tendons there, right? So that itself is its own phenomena. I'm sure the mast cells are involved on some level. I'm sure they are, and they're going to be talking to other cells that contribute to the inflammation. But I wouldn't say it's a mast cell phenomena alone. It's really not specific. But in general, yes, there are lots of different triggers that could activate mast cells that are already dysfunctional, right? And so that's kind of what we're talking about. Like most people with mast cell activation syndrome have what we would call idiopathic mast cell activation syndrome, not secondary. Although Dr. Weinstock mentioned secondary mast cell activation syndrome, and we certainly see that. But more often than not, there's some low-level dysfunction in the mast cells, and then there's a trigger, and it could be multiple triggers over time that eventually sort of bring out the disease process, and then you're sort of off to the races, and everything is inflamed. But that the vaccine injury itself, right, the vaccine itself is causing the injury because it's in the wrong location, so it's not just mast cell driven. Following up on the SIRVA question for Dr. Dempsey, I understand that the vaccine sitting in the tendon is causing a localized inflammatory reaction, but I'm wondering if that process could kick up off a systemic mast cell activation. So there's a previously healthy patient went from shoulder pain after SIRVA to mysterious body-wide pain after that. And yeah, I think that is absolutely possible. In the right setting with the right other triggers, I think that does make sense.